At the Blood Donor Center here at the Saddleback Memorial Medical Center. It's been open here for about 5 years. And I'm going to talk to Dr. Thomas Hiroshi. He's the medical director at the Saddleback Blood Donor Center. Nice to see you again. You've been on our show in the past, and I know you've been over at this location for a long time.
Yes, thank you very much for coming to our donor center. We've been developing a program so that we can collect blood and blood products from the community.
How long has this program been going on here?
We've been doing this program for the last several years. Of course, the hospital is much older than that. And recently, we've been expanding the ability to do more collections to address the needs of our patients in the hospital.
Well, I know a few years ago I was here, and I've noticed you've made a few changes. There's been some remodeling. It's an excellent facility here.
Thank you very much. We try to make a connection with the friends, family, and relatives of our patients that we serve, so we try to make an environment that will be friendly and easy and quick. The need for blood is so high, and we're trying to provide the opportunity in the most efficient way to address that need.
How are the supplies at this point, really throughout the country? Are we getting enough donors?
We're not. The U.S. uses about 18 million units of blood. And blood, as you know, when it comes out in a bag, has more than one thing. It has red cells, it has plasma, it has platelets. And if you combine all the different components that we can obtain from one donation, the transfused numbers is roughly double that of the blood for blood use each year. It's a challenge. About 15 years ago, the U.S. was not able to collect enough blood for its own needs, and we had to start to collect from Europe and from other locations. We have about 40% of the population that is medically able to donate blood, but it's a process that many people are either unaware or a little bit afraid of. Mm-hmm. And so roughly less than 5% of the population comes in and does regular blood collection. We've been very fortunate. I think that the ability to collect blood and transfuse to patients, it ranks in the top 10 of the discoveries of the 20th century. It allows us to save people who have lost blood in automobile accidents and in any kind of trauma. It allows us to do surgeries where a lot of blood is lost, but we have the ability to replace it in the midst of the surgery. So every unit of blood that's collected allows people to survive heart attacks, strokes, orthopedic injuries, all sorts of different diseases. It also opened the door to a type of treatment that allowed a huge population to survive, that being chemotherapy for cancer. When we give high doses of chemotherapy, by definition, we injure the cells in the body that are the most rapidly turning over, and that happens to be the red cells, the white cells, and the platelets. And in so doing, we need to support those patients so they don't succumb to anemia, low platelet count, or low white count. We're able to collect those products and transfuse them to the people to support them while their marrow returns to the normal status.
And in the past, people had concerns about, and I'm talking about maybe years ago, about receiving blood because they wanted to make sure that, one, it was compatible, two, it wasn't tainted in some way, whatever it may be. But there are many steps taken before that blood that is donated is actually used, correct?
It is. And the blood supply and the blood that we give to patients today is the safest product that we've ever had in the history of blood transfusions. This is because we have several steps that are simply identified. The first challenge in blood donation was to try to coax a donor population that had the least likelihood of having infectious disease. And what we're talking about is the HIV virus, it's the hepatitis viruses, because they have such impact, such mortality, such morbidity. The first step was to stop paid donation for the collection of blood. It wasn't that paying for services was a bad thing, but what ended up happening in the very infancy of blood collection was that we were attracting people that really needed the money to survive. So this was people that did not have homes, that were living on the streets. So that actually had a huge impact early on in the collection of blood, not allowing people to donate for payment. The second was identifying questions that are very personal that could try to identify the risk behavior in having a higher likelihood of having hepatitis or the HIV virus and so on. So today we have a very personal, a very directed, very focused risk behavior questionnaire with the ability to make our supply that much more safe. The third step was to do very sensitive testing for the presence of these viruses and other infectious agents. It's the best that it's ever been because of all the discoveries in science with molecular testing, biologic testing, all these things. And so that has made a huge difference in our ability to provide a safe product. I'm not sure if people are commonly aware of the statistic. We really worried about HIV and hepatitis C in particular. Hepatitis C is actually the most common transmitted virus agent that has huge morbidity and mortality. Believe it or not, 1 in 200 of our population is infected with hepatitis C. And so it still remains a huge challenge. And in knowing that, it's our responsibility to make sure that no unit of blood goes through that has the virus in it. To that end, our safety initiatives make it such that it's only 1 in 2 million chance of having both HIV and hepatitis C go through and actually be received by a recipient. These huge numbers really need to be put in perspective. And acceptable risk has to be discussed. In Los Angeles, the chance of having a fatal automobile accident, that's the chance that we accept as acceptable risk, is about 1 in 5,000. So again, for hepatitis C and HIV, it's about a 1 in 2 million. Another way to say that is it's more likely to be struck by lightning twice on a sunny day than to achieve a unit that bypasses all our checks and balances and goes to the patient.
And besides just the transfusions, I noticed that over in the corner there is a specialized machine, a centrifuge, I think you were telling me, to collect platelets. Is that it?
It is. And so, as we said earlier, a pint of blood has so many different elements in it. Each one can be used to save different patients. So if someone needs a cell that helps a person not bleed, that's a platelet. We have a machine that is able to have the blood come out of the arm of the donor, go into this machine that's a centrifuge. It throws the red cells out to the side. It has the plasma, which is liquid on the inside, and right in the middle is where we find the platelets. We have a chamber that can suck out the platelets, and we can collect those and provide it to people that need platelet support to keep them from bleeding.
Very good. Well, I can see the importance of donating blood, and in just a moment we're going to talk to Carol, who is the person that recruits people to come on over here and sets up all the different programs. So I want to thank you, Doctor, for sharing your time with us. I know you're quite busy. This is a fantastic center that has just gotten better over the years, so thank you very much.
Thank you for coming to our donor center.
And we're now here with Carol Carranza. She is the recruiter here at the Saddleback Blood Donor Center. Carol, nice to have you here. And you have a very important function. You are the person that gets people over here.
Yes, we have a lot of different programs going here, programs for employees only, programs for the public. We always try to make it interesting in here and fun. We have always have some sort of drawing going, and the current one for March is 2 Lakers tickets. So we really try to switch it up in here and keep people coming in.
I think that the one thing that people might have concerns over coming in giving blood is not about the safety of it, but how much time do I have to be over here, and will I feel weak or tired or any of the other effects that it might be possible after I give blood?
Those are really good questions. And yes, you need to prepare a bit when you come in to donate. We always tell people to eat a healthy meal before they donate. Make sure they're well hydrated, lots of water. So I always tell them starting even the day before, drinking a lot of water. And then always bring their photo ID. That's something we need to have every time. Okay. And then hopefully if you do all that and prepare yourself well, you won't be feeling any lightheadedness or any tiredness after your donation. We also tell people not to exercise for 24 hours after and to keep hydrating after your donation. And if you do all those things, you're probably going to be in really good shape.
And about how long does the whole process take over here?
A regular donation, whole blood donation, will take about 45 minutes to an hour. We really try to stay on schedule. We try to make appointments for everyone so that we do stay on schedule and have the staff here to assist everybody.
And then if you are somebody who gives the platelets, that takes a little longer, right?
Yes, platelets take longer. It could be an hour to 2 hours. We do make 2-hour appointments for that, depending on how many units we get from them. A platelet donor can donate 1, 2, or 3 platelet units at a time, depending on their platelet count.
Now, for somebody to give platelets, is it a special criteria they need, or is it just something that they offer to do?
What we'll do is that their whole blood donation take a platelet count, and then we get the results from that in about a week, and I give them a call out and let them know if they're eligible to donate platelets. It has to be at a certain level, and then we can book their appointments. You can donate platelets every 2 weeks, so that's a nice thing to do because platelets only last for 5 days. That's quite a bit of difference than whole blood, which lasts for 42 days.
Wow, I didn't realize that.
So we always need to keep our platelet donors consistently coming back in.
Now, every 2 weeks for platelets, what about blood donors that want to come back regularly? What is the time frame there?
They can come back every 2 months, so 56 days. So it's quite a bit of difference as well there.
All right, and what are, I know you're kind of adjusting some of the hours here, but in general, what are your hours here?
In general, it's 8:30 to 4, Monday through Friday. We are open on some Saturdays, and I'd like to encourage people, if they want a Saturday appointment, to call in and find out what our current Saturdays are. And then we are also opening late Wednesdays until 6:30 on some Wednesdays, not all Wednesdays anymore. So again, just giving a call in, seeing what our current hours are would be appreciated.
All right. Well, I want to encourage folks to come on over here and do this. And Carol, this is a great facility. As I was talking to Dr. Hiroshi, I know over the years it's just gotten better. You've done some additions here, and it's a nice, comfortable experience. And that's what we want everyone to understand, and how important it is to give blood.
Yes, we make it fun. We're encouraging people to come in and celebrate a milestone donation or a birthday or whatever. We're throwing parties in here and just having a real good time. So we'd really like to encourage you to come in and donate. Thank you.
All right. Thank you very much, Carol.